day, students. My name is June Carlo Aguian. You can call me Teacher June. And I am your science teacher. And for today's video, we're going to talk about the parts and functions of the human body. So, what are the major parts of the human body? What are the major organs of the human body? We have brain, lungs, liver, bladder, kidneys, the heart, the stomach, and the intestine. Interesting, right, students? So we will talk about first brain. The brain is the control center of the nervous system and is located within the skull. Its functions include the muscles control and coordination, sensory reception, integration, speech production, memory storage, and elaboration of thought and emotion. The lungs are two sponge-like cone-shaped structures that fill most of the chest cavity. Their essential functions is to provide oxygen from inhaled air to the bloodstream and to exhale carbon dioxide. The liver lies on the right side of the abdominal cavity beneath the diaphragm. Its main function is to process the contents of the blood to ensure composition remains the same. The process involves breaking down fats, producing urea, filtering harmful substances, and maintaining a proper level of glucose in the blood. The bladder is a muscular organ located in the pelvic cavity. It stretches to store urine and contracts to release urine. The kidneys are two bean-shaped organs located at the back of the abdominal cavity, one on each side of the spinal column. Their function is to maintain the body's chemical balance by excreting waste products and excess fluid in the form of urine. The heart is a hollow muscular organ that pumps blood through the blood vessels by repeated rhythmic contractions. The stomach is a muscular elastic pear-shaped bag lying crosswise in the abdominal cavity beneath the diaphragm. Its main purpose is to digest the food through production of gastric juices which break down, mix, and churn the food into a thin liquid. The intestines are located between the stomach and the anus and are divided into two major sections, the small intestine and the large intestine. The function of the small intestine is to absorb most ingested food. The large intestine is responsible for absorption of water and excretion of solid waste material. And now let's move on to identify the cause and treatments of the disease of the major organs. Brain. Your brain is your body's control center. It's part of the nervous system, which also includes the spinal cord and a large network of nerves and neurons. Together, the nervous system controls everything from your senses to the muscles throughout your body. Treatment. Depending on the type of injury you have, treatment may include medication, rehabilitation, or brain surgery. Lungs. Smoking infections and genes cause most lung disease. Your lungs are part of complex system expanding and relaxing thousands of times each day to bring in oxygen and send out the carbon dioxide. Lung disease can happen when there are problems in any part of the system. Treatment. For smokers, smoking cessation can help prevent the disease or keep it from getting worse. COPD can also be treated with inhalers, medication, oxygen therapy, and pulmonary rehab. In severe cases, surgery may be an option. Liver. Alcohol abuse and liver disease. Alcohol abuse is the most common cause of liver disease. Alcohol is directly toxic to liver cells and can cause liver inflammation, referred to as alcoholic hepatitis. In chronic alcohol abuse, fat accumulation occurs in liver cells affecting their ability to function. Treatment. Some liver problems can be treated in lifestyle modifications, such as stopping alcohol use or losing weight, typically as part of medical program that includes careful monitoring of liver function. Other liver problems may be treated with medication or may require surgery. Bladder. Cystitis inflammation of the bladder, often from an infection. Urinary incontinence, loss of the bladder control. Overactive bladder, a condition in which the bladder squeezes urine out at the wrong time. Interstitial cystitis, a chronic problem that causes bladder pain and frequent urgent urination, bladder cancer. Treatment. Medications that relax the bladder can be helpful for relieving symptoms or overactive bladder and reducing episodes of urge incontinence. Kidneys. Kidneys can become damaged from physical injury or a disease like diabetes, high blood pressure, or other disorders. High blood pressure and diabetes are two most common causes of kidney failure. Treatment. Kidney function will eventually deteriorate to the point where the kidneys can no longer perform their job properly. In this case, a person would need to go on dialysis. Dialysis filters extra fluid and waste out of the blood. Dialysis can help treat kidneys disease, but it can't cure it. Heart. High blood pressure, high blood cholesterol, and smoking are key risk factors for heart disease. Several other medical conditions and lifestyle choices can also put people at a higher risk for heart disease, including diabetes, overweight, and obesity. Treatment. A medication may be necessary to treat certain types of heart disease. Your doctor can prescribe a medication that can either cure or control your heart disease. Medication may also be prescribed to slow or stop the risk for complications. The exact drug you're prescribed depends on the type of a heart disease you have. Stomach. Stomach problems may be caused by conditions of the digestive tract including bacterial, parasitic, or viral infection of the gastrointestinal tract. Celiac disease, severe sensitivity to gluten from wheat and other grains that causes intestinal damage. Treatment. Many surgical procedures are performed on the digestive tract. This includes procedures done using endoscopy, laparoscopy, and open surgery. And now let's move on to practice the habits to maintain the healthy body. And I have here the top 10 habits that will help you to maintain your health and wellness. Number 1 is build your plate around healthy choices. Number 2, stay hydrated. Number 3, limit alcohol intake. Number 4, avoid quit tobacco usage. Number 5, walk more. Number 6, choose physical activities you enjoy. Number 7, wash your hands. Number 8, develop healthy sleep habits. Number 9, see your primary care physician regularly. Number 10, set goals and work toward achieving them. That's all for today's lesson. And see you soon, students. Bye.